start out, do you think that the goal of this roundtable was accomplished today?
Yes, the goal of this roundtable was for me to hear directly from leaders in Lewis County, from the law enforcement perspective, from the provider perspective, and local electeds as to how we can work effectively together to combat the heroin and opioid epidemic. It's also an opportunity for me to highlight the bipartisan work that we're doing in Washington to increase federal grant opportunities to support these local initiatives, and also passing common sense legislation to increase the number of providers who are trained in addiction and substance abuse healthcare. So it was achieved today, and as you could see, there was a lot of back and forth with people who work together on a regular basis.
And you mentioned some initiatives at the federal level that are being done. Leaving this roundtable, what's next now for Lewis County and helping them with this epidemic?
One of the most important things we can do at the federal level is provide federal grants for local communities. I'm a big believer that the dollars are best spent when the decisions are made at the local level, and I've been able to deliver federal grants not only to Lewis County but to Jefferson County specifically to combat the heroin and opioid epidemic, to Messina, to Clinton County, to Hometown versus Heroines in Warren County. So I really work with the local advocates and those that are impacted directly to make sure we can provide federal resources. Legislatively, on the policy side, the themes that we are focused on are prevention, making sure that we're investing in treatment. We heard a lot today from the waiting list to get adequate long-term treatment. Fighting fentanyl. You heard from many people today the fentanyl-laced heroin and fentanyl finding its way in marijuana. That is deeply concerning. We need to continue to crack down on fentanyl within the United States.
How important was having this discussion here in Lewis County? Is it the first time you're having this discussion, or have you been here multiple times to discuss this?
Well, I've been to Lewis County many times. I've met with many of these organizations, many of the healthcare providers, with local law enforcement. So I have these periodically throughout the district. It's important for me because I can get an update as to what they're working on. I can give them an update as to what resources are available from Washington. But it's the start of a busy August work period, so I'll be doing events like these all around the district.
What are some of the solutions you think could put additional resource, like a small county like Lewis County? You heard there's not a lot of facilities, treatment facilities, things like that. What are some things you would like to see moving forward that would help the county invest in things like that?
Well, I think because, one of the pieces of feedback I heard from participants today is that they work in partnership with healthcare facilities in other counties. We need to make sure that as we're giving federal dollars, we understand that some of this is regional and it needs to be programs that go beyond one county to the next. So making sure that, we're working with Jefferson County, making sure that we're working with Utica because there is so much communication. So that's about how federal grant requirements are written, and I think greater flexibility would help them. Additionally, every year Congress votes on appropriations, which is funding all of our federal programs, making sure that we're continuing to invest in federal dollars for these grants, which are utilized currently by Lewis County and other counties in my district.
And you also heard more of an impoverished county like Lewis County, the Medicare and Medicaid reimbursement rates. Is that something that you see you would be able to adjust with Congress as well?
Well, the Medicaid issue, a lot of that stems from New York State. New York State has a significant amount of waste and fraud when it comes to our Medicaid program. We spend more in New York State than any other state in the nation, and the taxpayers bear that burden, particularly at the county level. We're one of the only states in the nation that has a portion of Medicaid paid for by the county, so that limits the county's ability to invest in other very important initiatives like combating the opioid and heroin epidemic. So on the Medicaid issue, a lot of that needs to be cleaned up at the state level.
Okay. Thank you.
And really, what is the overall hope for a county like Lewis County, who has seen such hardship with the opioid crisis? What is the main hope and kind of out of this whole meeting?
So a couple of takeaways. One is raising the awareness of everyone in the community that it's going to take partners working together, whether that's at the family level, in our school systems, our teachers making sure they're aware of this, investing in prevention, so making sure that we are getting at the problem before it takes root, about increasing our treatment facilities and understanding that we can't arrest our way out of this crisis. Many individuals are suffering from the disease of addiction. Of course, I support our law enforcement as they are cracking down on the drug dealers, which are taking advantage of our communities. But those who are suffering from addiction, we need to make sure that they have the healthcare facilities and the healthcare options to have a pathway out of addiction and towards recovery.
One last question for me. What role do you think the federal government can play in holding pharmaceutical companies accountable, where this crisis, as far as the opioids, where it really got out of control because of that? Heroin's been around a long time, but that isn't what was out of control.
Absolutely. The overprescribing of prescription drugs has led to this crisis. We've passed in Congress updated CDC requirements that have to do with overprescribing. So, for example, I have met with recovering addicts whose path to addiction started with a broken limb, playing sports in high school. They were overprescribed their pain medication, and that led them towards addiction. We need to make sure that the CDC has updated regulations when it comes to our prescription drugs. Additionally, as I've talked to doctors and those that would make the prescriptions out, they need to be trained in medical school. So increasing the number of hours that are required for med students to study addiction and really have an understanding of the long-term impact. The other thing that we can do at the federal level is make sure that we're sharing information across state lines. You know, much of my district on the eastern side borders Vermont, and there are cases where there are individuals who are going to get the painkillers in Vermont and they're coming to New York to get the painkillers. So making sure that that information sharing is working effectively to really crack down on people that are overprescribing.
But what about the companies themselves? They misled doctors saying, no, this is fine, you won't get addicted if it's for pain, no problem. And that's coming out more and more in the courts. What role can the government play in hoping and preventing this from happening again with future medications? Since it's all about, it's a business, it's about money for them, but at what cost? At what point is the line drawn?
So we have hauled them before Congress to testify. We need to hold them accountable and make sure that the bad actors are held accountable in the court system. And making sure that they're required, when they know that these are very, very addicting drugs, they need to make sure that there is some type of requirement that the public knows that and the prescribers know that as well.
And those steps have been taken?
Oh, yes.
Okay.
I mean, there has been very high-profile testimonies in front of Congress, and I think that accountability is incredibly important because there are bad actors when it comes to this. If you look at, West Virginia studies, the amount of a certain type of drugs that's gone into West Virginia, that has very much led to the opioid crisis there.
Yeah, absolutely. Thank you very much.
Let's just do one more, okay?
Yeah, one last question, just on this side, we'll swing around. We did kind of mention the marijuana and alcohol and tobacco leading into all of this, and before we all spoke here today, Governor Cuomo signed something into law allowing the recreational use of marijuana. What are your thoughts kind of on that with this situation going on in this county?
I don't support the legislation at the state level. I do not support legalizing marijuana. My concern is, as we have this crisis of addiction across the state, and as we hear from those in recovery, many of whom used marijuana as their first kind of gateway drug, I've heard individual stories of people who have said that unfortunately ripped their lives apart. So I don't support the legalization. I think there's a lot of questions that the public needs to continue asking our state legislators on that issue, but that's an area where I disagree with Governor Cuomo.
Any thoughts or comments on President Trump's recent tweets about Baltimore being against Nancy Pelosi?
Well, in terms of the tweets, the president tweets more than I tweet. He tweets too much sometimes. I have to look at the specific tweets, but there are examples where I've opposed the president's tweets. What I am really proud of is the president, when it comes to this issue, he has really stepped up and made this a national priority and has funded more dollars than any president prior to combat the drug epidemic in this country. The economy continues to do well nationally. While we have our challenges in upstate, if you look at unemployment has gone down in the 12 counties I represent. So I'm proud to work with the president on areas where I agree, but some of his tweets I disagree with.
All right, thank you guys.
Thanks.
Thank you.
Thank you.